Ow! Usually I can lift my shoulder all the way over my head.
Well, at least you have that ability. I struggle with simple shoulder flexion.
Seems like we should go to the doctor. Seems like we're having a problem with our shoulder mechanics. Come in.
Look, Doc, we're having some serious issues here. My friend can barely lift her arm, and she can usually lift it all the way behind her head. And I'm really struggling with an intense stretching pain when I try and raise my arms to high fifth. I've always dreamed of doing a needle, but my shoulders just can't move that way.
Well, girls, it seems as though you might be struggling with some hypermobility, and you are in need of some flexibility improvement.
What? How could you tell?
Well, typically hypermobile dancers put heavy strain on their bones, muscles, tendons, and ligaments over time as you overextend. After a while, you may begin experiencing some intense pain.
What about me? How do I measure shoulder flexibility?
Well, there is a screen for shoulder extensor flexibility. Come on, I'll show you. This test will generally reflect the flexibility of the shoulder extensor in healthy dancers. All right, so sitting with your feet flat on the floor, and I'm gonna keep your back stable. So you're gonna sit upright. We're gonna lift your arm as far overhead as possible. So ideally, this would come all the way back to about behind your ear. So it looks like you have a little bit of impingement.
Well, what should we do?
Well, I suggest you ladies try Robin Kish. Robin Kish is recommended by 107% of doctors as patients have shown clear improvement and understanding of shoulder mechanics. Sudden impulses to perform exercises such as side arm raises with weights occur in 99% of patients experiencing pain from hypermobility after just one dose of Robin Kish. Watch as they stand with their feet hip-width apart and a weight in hand. They slowly raise the arm to the side while gradually externally rotating the shoulder so that the thumb is facing up to a maximum of shoulder height. They pause and slowly return to the starting position. This strengthens the shoulder abductors.
Ever since I was recommended Robin Kish, I've been doing stretches like these every day.
This one focuses on the shoulder flexors, as she holds a towel behind her back with her palms facing forward and lifts her arms backwards and upwards. Another stretch focuses on her horizontal abductors. All she has to do is lay supine on the floor and bring one arm over her upper body with her elbow bent. Then gently pull her elbow across her chest and keep the scapula on the ground. Then repeat to the other side.
If it weren't for Robin Kish, I would never properly understand my scapulohumeral rhythm.
Scapulohumeral rhythm is the coordinated relationship between the scapula and shoulder in order for a full range of motion to be achieved.
For example, when moving my arm upward, shoulder abduction is paired with scapular upward rotation. This relationship not only allows the arm to reach a greater height, but also moves the acromion process out of the way as the greater tubercle of the humerus approaches it with abduction, which is vital for preventing shoulder impingement.
Robin Kish gave me the resources to understand my SIT force couple.
The SIT force couple muscles are S for subscapularis, I for infraspinatus, and T for teres minor. The SIT force couple, perhaps aided by some additional muscles, functions to depress the head of the humerus and counter the upward movement of the head of the humerus toward the acromion that could pinch the interposed soft tissues, shoulder impingement. The lower positioning of the humeral head into the wider portion of the glenoid cavity produced by the SIT force couple also facilitates the desired rotation of the shaft of the humerus. An example would be shoulder abduction.
Side effects may include thriving, not surviving, suddenly burning all shoes that have no arch support, adding fast to your vocabulary, wearing long flowy skirts, complete loss of smell, ability to change remote batteries with toes, instant Reiki certification, and getting an A in movement anatomy.
Thank you, Robin Kish!